Thank you for joining us tonight on this CUPE Ontario webinar on vaccination. There's been huge interest in this webinar tonight. And so we're just, as people come on and join us, we're just going to take a few moments, make sure for those of you who are online that you have a comfortable place to sit. You might want to have a piece of paper and a pen to make notes, or for those of us who are more tech savvy, a note, some kind of other ways of making notes with a tablet or whatever. We're looking very forward to the webinar tonight, and it's an important opportunity to hear from some leaders in our union, but also some experts about vaccination as well. We had, as I said, a huge number of folks who pre-registered. And so there are hundreds of folks who are joining the webinar, and we're just going to make sure that they have as much time as possible for people to sort of onboard for the webinar. We are going to spend as much time as we can tonight hearing questions from all of you. I just want to welcome you again. I am Fred Hahn. I am the president of CUPE Ontario. I want to welcome you to this webinar that CUPE Ontario is doing on the question of vaccination. We're joined by a number of our leaders and some expert staff, as well as experts from the community on this question tonight. We have hundreds of folks who are joining us during this webinar. And so we're just making sure that all those folks can onboard before we start officially. We're also broadcasting this live on Facebook so that as many people as possible can see it. I want to suggest that you get, a pad, a paper, something to write notes down, or, a tablet, your laptop, some other way to make notes if you find that useful. Get yourself comfortable, and we're going to get going. We know that there's been a lot of questions about vaccination, including questions about safety and effectiveness and your obligations in the workplace. This webinar is an opportunity for our members in CUPE Ontario to ask those questions and to debunk myths about vaccines. Before we get started, I want to note that we have simultaneous translation happening tonight, both translation into French, but also translation into American Sign Language on tonight's call. If you want to listen in French, and in fact, I'm going to ask everyone on the webinar to do this. If you move your mouse, you'll notice at the bottom of your screen a globe icon to the far right. Some of you might be on tablets. You'll see 3 dots. You want to pick that interpretation and pick English to hear in English, but also French to hear in French. If you see the 3 dots, there'll be an option called language interpretation. Again, you'll want to be able to, for those of you to hear in English, please select English. For those of you who want to hear it in French, please press French. The reason we're doing this is that if we have questions asked in French, we'll be able to hear those questions translated to us in English, and we'll be able to have a full conversation that way. I also want to make sure that those of you who are relying on ASL interpretation can know that you can pin the ASL interpreter in your screen so that they become larger and you can see that interpretation more clearly for those of you who rely on that. Today, we're going to be hearing from Michael Hurley, who's the president of CUPE Ontario's Council of Hospital Unions. He'll talk about rollout and supply and some of the disruptions that's happened there. Many people have questions about who will be vaccinated and when. Michael will give us an overview of the Ontario government's prioritization plan and how that's been impacting healthcare workers, how it might impact other members, and how we need to, why we need a comprehensive vaccination plan that leaves none of us behind. The COVID-19 pandemic has had significant impact on racialized communities. Yolanda McLean is CUPE Ontario's second vice president. She's also joining us tonight to talk about how vaccines factor into this, including vaccine hesitancy within Black, racialized, and Indigenous communities. And she's going to highlight some of the available options to ensure that governments are responding to these concerns of historically marginalized folks. And finally, we're going to hear and be joined by Dr. Tara Moriarty, an associate professor of infectious diseases at the University of Toronto. Tara has been conducting daily Zoom meetings with anyone who wants to join to answer everyone's questions about vaccines against COVID-19. Tara will give us some insights into the vaccine and address some of the concerns that people have about them. And following the remarks of our panelists, I'm going to pass things over to Candice Rennick, who is the Secretary Treasurer of CUPE Ontario. She will introduce the Q&A section for all of us tonight. We're also joined tonight by a CUPE lawyer, Saranjit Chima, he'll be here to answer legal questions around workplace issues. We're also joined by CUPE's Health and Safety Representative, Paul Silvestre, who's here to talk to us if there are questions about health and safety. Want to welcome them and thank them for joining us tonight. We do have questions that were submitted in advance of registration, but you can also ask questions tonight using the Q&A function at the bottom of your screen. That is the way that people are going to ask questions. We have people monitoring the Q&A. We're going to get to Q&A as soon as we can. I want to thank all the speakers for being part of tonight's webinar, for lending their expertise to help us through this incredibly urgent issue. And I want to emphasize that the concerns people have about the impact of the vaccine on their health are understandable. I also want to start by summarizing the principles that we've been approaching the question of vaccination from in CUPE Ontario. Those principles have been guided by our work with the Ontario Council of Hospital Unions, we've been encouraging these principles to be adopted throughout our national union in relation to questions on the COVID-19 vaccine. First, we unequivocally support vaccination. We know that our collective responsibility to one another means that we have to do all we can to protect our coworkers, to protect those we support at our workplaces, our families, and our communities. We will push governments to ensure that vaccination is comprehensive. All of the workers at a facility, no matter what their job classification, along with all of the residents or patients or clients, all the visitors, volunteers, all of these folks have to be vaccinated in a comprehensive way to achieve the full benefit of vaccination. Vaccination programs must also be voluntary. No employer should ever have the ability to make decisions about vaccination for workers. That should be a decision made by people themselves after they have had good, accurate information, and if necessary, in consultation with their doctor. Some people should be exempt from vaccination due to severe reactions or other reasons that the vaccine might be contraindicated for some people. And any discussion of vaccination really cannot be divorced from the ongoing need to ensure real and appropriate personal protective equipment is dealt with in all of our workplaces, that treats COVID-19 appropriately as an airborne virus and ensures that all workers in those workplaces are protected against that exposure in the best possible way. I also want to say unequivocally, as soon as I am able to, I am going to get vaccinated. And I am encouraging everyone else that I can speak to, that I know, to get vaccinated too. It is part of what we must do for each other. With that, I'm going to pass things on to Michael Hurley, who is the president of the CUPE's Ontario Council of Hospital Unions. Michael.
Thank you very much, Fred, and thank you very much for joining us this evening. I just wanted to reinforce CUPE's position in terms of encouraging vaccination. This really is an issue of our collective responsibility to one another. And the union does appreciate that there are people who cannot or will not take the vaccine. We are going to support all of our members, absolutely, and Saranjit can answer questions around that. But we encourage people to take the vaccine, and we've written to the ministers of health and long-term care, and we've emphasized the points which Fred just reviewed, that any program has to be voluntary, that it has to be comprehensive. It can't only be the people who are most directly in contact with patients or residents who are vaccinated. For example, in healthcare, it has to be everybody. In fact, a recent study of cleaners found the people with the highest count of antibodies were actually the cleaners in a facility. They weren't the ICU nurses, because the ICU nurses tend to actually be better protected with protective equipment. We're also asking for, exemption for people who have religious or medical reasons for not being vaccinated. We're asking for people to be paid in the event that they have one of those rare allergic reactions. And we're asking the government again for pay for people who have to isolate or quarantine or take sick leave as a result of COVID. I'm sure you know as well as we do that there are now supply problems with the vaccine, and in particular caused by the retooling of the Belgian plant of Pfizer and by some restrictions by the European community with respect to vaccination exports. The last that we were told this would impact the vaccination program in Ontario by a minimum of 2 weeks, but quite possibly longer. The government has reiterated to us that their priority for vaccination remains the high-risk populations, including the staff working in long-term care, high-risk retirement facilities. So the residents and the staff and the essential visitors in those facilities, and also in the First Nations communities, the people who are elderly, who are in residences, are also targeted as a priority. And we have asked the government to deal with the issue which has been reported of queue jumping, where, for example, hospital administrators move to the head of the line to get the vaccine ahead of other people. Obviously, there is a delay in the arrival of the vaccine. This is going to set back this vaccination program, and as a result, people are going to have to wait longer. And we're asking the government to be clear that there will be a logic and an order in the distribution of the vaccine, and that it will be comprehensible. And we hope that will be the case. As of last night, 335,412 vaccine doses had been given out in over 479 long-term care facilities and 540 retirement homes. The vaccine has also been moved to 14 health units, which did not have vaccine supply until this point. So in terms of what the government's plan is on the priority for vaccination, for the population, for the workforce, in the first phase, which was to have gone to April, but which may now be pushed back, as I mentioned, healthcare workers and vulnerable populations in long-term care facilities and retirement homes, and those people who are elderly in First Nations communities, remote communities, are the priority for vaccination. In the next phase, which was originally to be from April to July, the other healthcare workers, for example, the hospital workers, the paramedics, etc., are up, as are other essential workers, including farm workers, police, school board workers and teachers, etc. And in the general population, people over 75, followed by people 50 to 75. And of course, people with underlying immune conditions, for example, people with autoimmune issues will be advanced ahead of people who are in good health, who are in in one of those age groups. But I'd like us to, and as soon as we have more knowledge of the government's plan around the vaccinations, we're going to share that with you. But I would just say, particularly to the healthcare workforce, while we have delays in the vaccine, and given that we're now dealing with the variants which are more highly contagious, it's more important than ever that we insist on our rights to be equipped properly in dealing with this vaccine in the workplace. There are issues which Paul Silvestre, the health and safety specialist, can talk to you about in terms of engineering controls, but CUPE Ontario and OCHU have shipped out to locals purse cards, wallet cards, and now posters in both official languages, which link to the directive which sets out the rights of employees in these in these situations. Regulated health professionals have a right on their own judgment and clinical expertise on seeing a resident or a patient to make a clinical determination that they have a right to access this equipment, and others do in outbreak, etc. I'd just like to mention to you that as of yesterday, 17,250 healthcare workers in Ontario contracted COVID. That's up almost, that's doubled, more than doubled in the last 3 months. And we now have 20 dead. And that's up. It's not doubled, but it's getting close. So this issue of personal protective equipment, particularly in dealing with the variants, is so important while we're waiting for the vaccines to arrive. There are many other people, including Dr. Moriarty and Saranjit and Paul, who can answer your technical questions about some of these areas. And again, as soon as we have more information on the government's change plans in terms of any distribution of the vaccine, we'll get that information to you.
Thank you so much, Michael. Just really want to underline how important the issues of keeping yourselves and your coworkers safe at work are. We're now going to move to Yolanda McLean, who is our second vice president. I'm going to pass things over to Yolanda.
Thanks, Fred. Black, racialized, and Indigenous people have felt the impacts of the COVID-19 pandemic more significantly than others. Not all jurisdictions collected race-based data, but as an example, as reported by the CBC in November of 2020, racialized people in Toronto comprised of 79% of reported COVID cases, while making up 52% of the population. Racialized people accounted for 71% of COVID hospitalizations. Black and racialized people disproportionately work in lower wage jobs, including healthcare that Michael just talked about, but also other frontline services. Lockdown measures and fines are disproportionately impacted Black and racialized folks. But while this pandemic has had a disproportionate impact on Black and racialized communities, the government's response has not taken this into account or responded efficiently at all. Not only has the pandemic harmed Black, racialized, and Indigenous people in terms of COVID diagnoses and outcomes, we may also face a second wave of harm when it comes to this vaccine hesitancy. The experiences of equity seekers in the medical system have been studied and documented. Many have had poor experiences with accessing medical care and having our symptoms taken seriously. We cannot ignore the fact that there has been systemic racism in our medical system. Our current crisis cannot be divorced from our history. And Black, racialized, and Indigenous people have been the subject of unethical medical testing and interventions. And so it's also, the reluctancy is very normal. That's why we're making sure that our members have access to the information, and hopefully tonight that will help. And sharing your stories and asking your questions. It is only through two-way conversation like this and like tonight that we can help those around us become more comfortable with voluntarily taking the vaccine to protect themselves and those around us. We are in this together, and that includes Black, racialized, and Indigenous folks. And I want to be clear, while we're holding tonight's call and while others like our doctor that's joined us continue to work to open up conversations with the broader public, our government has failed us. For a year, we have all known that the way out of this pandemic is going to be vaccines. We must hold all of our governments, all of our levels of our government accountable for their failure to develop and launch a broad public health campaign about the vaccines and the vaccine safety. This campaign should have put resources into outreach to our Black, racialized, and Indigenous communities. There are community organizations which have already been and willing to do the outreach. They've got the education. They can even deliver the vaccines, and trusted organizations in their communities. They are the best equipped to do this critical work. They've done it in the past, and they can do it again. And in the absence of a campaign, the community is stepping up to educate and support one another. I acknowledge the real concerns many of you have about this vaccine. You should not feel ashamed about those concerns, but I do encourage you to ask questions on tonight's call. If you're unable to ask questions tonight, you can visit the CUPE Ontario website to find more information about how to access Dr. Moriarty's sessions over Zoom, where you can ask questions of medical professionals, including asking questions in confidence. I also want to end just by saying that I know that vaccines can seem scary, but I also know that with our limited options, it's the best way to protect those around me, including those who are most at risk. And I thank you for this opportunity. Back to you, Fred.
Thanks so much for that, Yolanda, and thanks so much for this important message of incorporating the reality for many of our frontline workers who are Black, Racialized, and Indigenous members. It's an incredibly important part of this conversation. I'm going to pass things along now to Dr. Tara Moriarty, who is an Associate Professor of Infectious Diseases at the University of Toronto. As a reminder, you can find information about joining Dr. Moriarty's Zoom sessions by visiting cupe.on.ca. Tara's been so generous with her time, not just with us, but with so many others. Thank you for joining us tonight, Tara.
You're most welcome, and thank you for having me here. I started these Zoom sessions on January 4th, mainly because at that point I was getting extremely worried about vaccine rollout. And I was getting extremely worried because there didn't seem to be an accompanying education campaign or any kind of information that was available. I'm an infectious disease researcher, but I'm also an essential caregiver, and my partner and I took care of my mom, and before that my dad, for nearly 10 years, both of whom had dementia. And we couldn't take care of my mom anymore by the summer of this year, and she moved into a retirement home. My dad was in long-term care for the last year of his life, so I'm very familiar with this setting. And I've also been reporting on long-term care and retirement home cases and deaths across the country for quite a few months, and I was extremely worried. So I got up in the morning on January 4th and I thought, I don't see anything happening. Just screw it. I'm just gonna, start Zoom sessions and see if anyone needs them, and if I can help in any way, because in that setting where the early vaccination was targeted to long-term care, and that setting, every delayed vaccination or vaccination that doesn't happen could cost a life. And so I knew that there wasn't an hour to spare in that setting. And what I realized was that there was a gaping need for this. I wasn't seeing it. I would be someone who would know about it because of what I do for a living. And I had no idea how badly this resource was needed. So we've been doing sessions every night, and then during the day we do sessions for any organization that wants them. There are approximately 50 volunteer scientists, doctors, and pharmacists now who have joined up to help give these sessions. We are now, as of today, CISAPO, which is a nonprofit organization, is giving us or allowing us to use their Zoom platform so people can call in with a 1-800 number. Which allows them to protect their anonymity even more. And it's also important for people without internet access. So what we've realized is that even though there's more information going out on paper and everything else, still, we are human beings. And what we have seen in these sessions over and over and over again is that for many people, myself included, it helps to be able to talk. It helps to be able to ask the questions when you think of them, and to perhaps be anonymous if you want to, not necessarily do it in the context of your workplace, because people might be afraid to ask questions in their workplace and look stupid or uninformed or have people judge them. So we do this every night for a couple of hours and multiple sessions during the day. And we're going to keep doing it until we're not needed any longer. And I would say if any of you are part of any community that would welcome or benefit from anything that the scientists, doctors, and pharmacists who've joined up to do this, if there's any way that we can help, we will completely adapt to whatever a community's needs are. And we will do exactly what's needed. If if we understand it well enough, and we will be there. We're there to serve and to support everyone who's going through this, especially starting in long-term care, which is one of the most horribly impacted and least supported settings in this epidemic, and all essential workers. So we are here if anyone needs us, and we will be here until we're no longer needed. And that's it. So I want to thank you for letting me be here.
Well, we're very glad you're here with us, and I just really want to thank you. And I know folks want to hear from you more, and I know we want to get through and get to the questions. That's really what the heart of this is all about. So I'm going to turn things over to Candice Rennick, who is our Secretary Treasurer, my co-officer in CUPE Ontario. Candice.
Okay, thanks so much, Fred, and thanks to all of you for joining us tonight. This is the most important part of the Zoom call. It's an opportunity for us to hear directly from you. I just want to say, I know we see people are raising their hands. The way to ask a question this evening is to type out your question in the Q&A. We're not going to be acknowledging hand raising, so please type in your question in the Q&A. So as was mentioned, this is your chance to ask questions directly of the panelists. If you have concerns regarding the legality of not taking the vaccine, specifically for those who cannot take the vaccine for medical or religious purposes, or questions about the employer's duty to accommodate who can't take the vaccine, we have a CUPE lawyer here and a health and safety representative on hand to support those questions. We've also have some questions that were submitted in advance of on the registration page, so we'll be taking those questions, some of them. But as a reminder, again, you can use the Q&A button to pose your question. Please write your question there. We will pick some questions and ask you to come on to the line live so you can ask your question directly to the call. You will see a request to unmute your microphone before you get brought online live. So there will be a slight delay by the time the technician makes that request and you click accept. So we are asking for people's patience tonight as we move through this process. We do have a lot of questions and participants tonight, so we are asking you to please keep your remarks concise so that we can take your question and move on to as many as possible. We have already dozens of questions that have come into the Q&A chat. We're asking you to please include your local name, your name as well as your local. And while we do appreciate that there will be specific questions related directly and specifically to your own workplace, we are asking that you direct those questions to your national representative or a member of your executive board. For those of you who joined after the call started, we want to remind you that if you require ASL, please click the 3 dots icon at the top right video of the ASL's interpreter's video and select PIN. This will ensure that you can always see the interpreter. But before we start, I want to ask you a quick polling question. You will see the poll pop up on your screen and you can choose one of the 3 options. The question that we're asking you tonight is, when you are offered the vaccine, do you plan to receive it? If you do plan to receive the vaccine, you're going to say yes. If you don't plan to receive the vaccine, please say no. And if you're not quite sure yet, we're asking you to indicate that as well. So again, the results are coming in line live. If you do plan to get the vaccine, say yes. If no, you're not getting the vaccine, the answer is no. And if you're still not sure yet, the answer is not sure. So we'll give you 3 more seconds, 2 seconds, 1 second. We'll cut it off. Okay, so it looks like 57% of you have indicated that you will be getting the vaccine. The rest of you are saying you're not sure, and the answer is no. So we are hoping that this call does help to alleviate some concerns that you might have. Sorry, I feel like I can't get my notes back, Darius. Yeah. Sorry, Darius, I've completely lost my notes, which have all the questions on it that I'm going to ask you. So I don't know why my notes have disappeared, but we hope that you are able to find some answers during this webinar tonight and hopefully get some answers that you need so that when the time comes, you are ready to take the vaccine. Okay. And I don't know why this is happening, so I apologize profusely to everybody.
Candace, I have a copy of it if you want me to drop it in the Slack. Do you want me to
No,
put it in
no,
the
it's
chat?
not that. It's just, I have it as well. I just can't seem to get it. Okay, so we're going to move to some questions that have come in on the chat. So let's go to the first question. It's going to be from Terry Batley. So Terry, you are going to have to accept the technician's link to say that you want to come onto the line live. Terry, you are on the line. Please go ahead and ask your question.
My first question was, where are, as far as the vulnerable populations, where are those with disabilities and the caregivers that provide them their care in their private home on the list, as well as those that would be providing care in group homes?
Okay, who wants to take that question? Michael, go
I
ahead,
can do that, Candace, if you want.
please.
Yeah. I mean, because of the deaths in long-term care, we've got 3,400 deaths of residents in long-term care. We have 11 staff dead in long-term care and retirement homes. So the first priority for the government for vaccination is long-term care and high-risk retirement homes, and the residences for elderly and Indigenous people and First Nations communities, particularly the northern remote ones. Other healthcare workers, including people working, with people who are in group homes or with developmental disabilities, are the next down, and that's based upon your likelihood of exposure. You could expect that paramedics and people who are working in a complex continuing care facility for people who are developmentally disabled would be prioritized ahead of hospital administrators, for example. So healthcare workers generally are the next group. There's 500,000 of them working in long-term care hospitals, et cetera. Social service workers are working in these occupations. And then we get to the people who have, weakened immune systems. We have people over 75. We have other essential workers, which could include police and could include teachers and school board employees. And it could include other social service workers, farm workers, and people 50 to 75, followed by the rest of the general population. And unfortunately, Terry, as you know, the vaccination schedule has been set back because of delays in the arrival of some of these vaccines. First Pfizer, and now there's problems with Moderna. So everything is backed up a little bit, and we need to be patient, but we also need to be scrupulous in terms of our using whatever precautions we can to protect ourselves while we're waiting for vaccine. Those of us who are working in environments where we are at risk, and that includes, of course, school board employees, it includes social service workers, it includes people working with people with developmental disabilities and other healthcare workers.
Thank you.
Okay, that's great. Thank you so much, Michael. Many members from different sectors wrote in to ask about the timing of getting the vaccine. Casey, for example, from Local 5404 wrote, when can essential workers outside of long-term care, retirements, and hospitals get vaccinated? And what about the severely immunocompromised people that we support? When will they be eligible to be vaccinated? Michael, did you want to take that one as well?
Well, I thought I kind of just did that one, Candace. I think, immediately it's long-term care, retirement, and the populations they look after, including Indigenous and First Nation reserves, followed by other healthcare workers, including social service workers working in group homes and with people with developmental disabilities, etc., people with compromised immune systems, older Ontarians, other essential workers, including, for example, school board workers, followed by the general population. So the problem we have is that everything is pushed back a little. Exactly how long, we're not entirely sure.
That's great. Thank you.
I may be able to add a little bit more, Candace.
Sure, go ahead, Paul.
The
Thanks.
province has outlined, they have a timeline for which is called phase 2, which is a lot of frontline essential workers, which is supposed to be rolling out in March to July of 2021. That is, as Michael said, contingent on supply. They're looking at receiving from the federal government 15 million doses between the months of April and June. So hopefully that supply will come, and as Michael mentioned, it's going to be targeted towards a whole slew of frontline workers outside of healthcare who have not been addressed in the first phase rollout, and other individuals who have high-risk conditions or who are severely immunocompromised will be, and their caregivers as well, will be included in that second phase rollout, which I said is scheduled for March, leading to July 2021 before that. And after that, hopefully, if everything goes smoothly, then it will be rolled out to the general public during the summer.
Great. Okay, thank you, Paul. We're going to go to another live question now. We're going to ask Leela Pa to come on the line. Give Leela a second to accept the technician's request for her microphone to be turned on. I see Leela has joined us. Go ahead, Leela.
Hello, my friends. I'm Leela Pa. I'm a paramedic with CUPE 911 and a proud member of the CUPE Ontario Indigenous Council. So I have a question, and it was kind of more along the lines of, what can I do to help protect myself while waiting for the vaccine?
Tara, do you want to take that?
Sure, yes. Well, I mean, you need to continue doing what we are all being recommended to do. So keep your distance, try to stay out of indoor areas, especially if they're poorly ventilated, where there are lots of people. Wash your hands constantly, mask, again, try to stay out of crowded settings without great ventilation. And certainly in a hospital, for example, the air exchange rates are pretty fast in most places. In most places where people work, but there are issues in a lot of other settings. But we have to keep doing exactly what we've been doing all along. And I also wanted to point out, with these vaccines, we don't know yet. We know that they're 100% effective in protecting against death, and they are about 95% effective in preventing severe symptoms. But we don't know yet if these vaccines are going to prevent the spread of COVID, of the virus that causes COVID, from one person to another. There are early data out of Israel and other places that suggest that looks like it's what is happening. We would expect that this might happen, but we probably won't know until the spring whether they're actually going to prevent spread, which means that we don't know yet if, even if we're vaccinated, we could still infect others who are not vaccinated. So we need to continue with all the measures that we've been using to date. And I would imagine that your local, the health and safety expert, or people who are providing advice for your specific workplace setting would be the ones who would best understand what the issues are that you would be facing in the way that you work, and they would have more specific recommendations other than the general ones. Does that help, Leela? I'm sorry I can't be more specific.
Yeah, no, that does help. It provides a lot of clarity, and it just kind of cements that what we've been doing has been right all along. So we'll just continue doing what we're doing.
We just
Thank
have
you,
to
Leela.
all keep pretending. Yeah, we have to keep
Paul,
going.
is there anything you want to add, Paul?
Sure, it's just everything Dr. Murray already said is perfect. This is not the time to be taking our foot off the gas as far as protections in the workplace and measures and procedures, especially in light of the new variants, and especially in the general sense that we believe that we haven't been provided enough protections. So we want to ensure that we keep pushing for the protections. Don't take your foot off the gas. And if you see any dangers or hazards that are new, that are upcoming, that are maybe something you're not sure about, you know, we workers have a right to talk to our supervisors and employers and ask questions to try and improve those measures and procedures. And if you're not satisfied with the answer, you can always reach out to a Joint Health and Safety Committee member or the local or the executive to try and understand better how we can ensure those measures and procedures are all carried out in the workplace.
Great, thank you. This next question came in from many CUPE Ontario members. The question is, will it be mandatory to get the vaccine in order to work? What happens if, due to other health reasons like previous severe allergic reactions, members can't get the vaccine? And what happens to those folks who don't have a medical reason but just don't want to get the vaccine? I'm going to turn that over to our legal representative, Saranjeet. Go ahead, Saranjeet.
Thank you very much, Candice. So anytime we're dealing with vaccinations, we can look at two different situations. We have a unilateral employer policy, or we have a negotiated policy where the union and the employer have come together to make some sort of decision. In either case, those policies have to comply with the Human Rights Code, the Occupational Health and Safety Act, and labor law generally. So on the first two, when it comes to the Human Rights Code, individuals may require accommodation based on medical grounds. They may have allergies, they may have issues with pregnancy or other advice they've been given by their doctor. So it's very important, if you do have a medical condition or you have medical concerns with regards to the COVID-19 vaccination, that you go to your doctor. It's very important to get that medical advice at the front end, and that way you're prepared in advance. If you require an accommodation, be it either medical or religious, very important to go to your local executive and let them know that you require an accommodation, so they can make sure they have those conversations with the employer and ensure that your rights are protected. There's also a general consideration that employer policies have to be what's called reasonable. What is reasonable is largely dependent on where you work and the type of work that you do. An arbitrator, which is an adjudicator in labor law, analogous to a judge, they'll look at a policy very differently if it's maybe in a long-term care home with direct care versus a municipal office worker or a transit worker that may not have direct contact with individuals in the public. So really important when you are looking at whether or not you have to take the COVID-19 vaccine or whether or not it can be a part of your employment. And those are two very important differences. Now, an employer can't force you to take it. However, they may make it a condition of your employment. And if it is a condition of your employment, it has to abide by the Human Rights Code. It also has to be reasonable, and it also has to be in line with your collective agreement. Many of you will be in workplaces that already have vaccination policies. Your local may have already negotiated a vaccination policy. So it's very important to know what's in that policy to ensure that you are provided perhaps reassignment. You're allowed to make use of leave if you have the ability to make use of that at that time. So those are the top line things you always want to go to. Is there a Human Rights Code basis for accommodation? Is there otherwise a problem with health and safety for you in particular? Is it in line with your collective agreement? And finally, is the policy reasonable overall? There's also generally, there's a general rule of what's called work now and grieve later, but there are exceptions to that. For example, health and safety. If what the employer is requiring you to do is fundamentally endangering your safety, for example, you have an allergy to this particular vaccine or another vaccine, the work now, grieve later wouldn't work for you. You would want to make sure that you make use of your ability to reject unsafe work or reject unsafe policies if you do have an allergy. And there's also issues where the grievance procedure may not be able to provide you an adequate remedy. Once you've taken the vaccine, there's no real way to go back, which is why it's important to be proactive. And I think that covers, Candice, the three parts of that question.
Great, thank you so much. Go ahead,
Could I
Tara.
be able to add a clarification? Sorry, just about allergy. I just wanted everyone to know that in particular, the two vaccines that have been approved in Canada right now, the Pfizer and Moderna, actually have a really excellent safety record for allergies. So in fact, there are almost no allergies that would preclude getting these vaccines. So you can have environmental allergies, food allergies, insect allergies, drug allergies, all kinds of allergies. And these two vaccines, because of the way they're made, are extremely safe under those conditions. Of course, if you have an extreme allergy, you'll want to talk to your doctor and let the vaccination team know. But they're prepared for allergies. These typically occur within 15 minutes of the vaccination if they're going to occur. But they'll observe you, and you're always observed for 15 minutes after vaccination. They'll keep you longer to keep an eye on you. But the only known allergy to this vaccine is a compound called polyethylene glycol, or PEG. PEG is in a huge number of the products that we use every day. It's in makeup, it's in food, it's in medical products, medical solutions. It's everywhere. It's extremely rare. So there are only 5 new each year in the US, which is a large country. And they're so rare that most physicians, pharmacists, others have never actually seen it in their career. And people who have PEG allergies, by the time they reach adulthood, will absolutely know about them, because there'll be so many things that they can't do, eat, consume, and it's a very specific, easily diagnosed allergy, even if it's rare. So I just want to let everyone know that there's a lot of fear around allergy, but these 2 vaccines in particular have been fantastic that way, because they're made with far fewer ingredients than many previous vaccines. And so allergy, unless you have a PEG allergy, is not something to worry about for yourselves. And I often hear questions about if I'm diabetic, if I'm on blood pressure medication. There are no issues with any other medications. The only thing would be people who are on very high dose corticosteroids, for example, as part of cancer therapy. They would often be quite ill to begin with, so they should speak with their specialist. And in that case, it's not a dangerous situation. It's that the immune suppression that comes from the corticosteroids is likely to make the vaccine less effective. So you'd have to be extra careful if you were vaccinated to not assume that you were protected, because your immune response might be suppressed. But I just wanted to clear that up about the allergies, is that it's not true, but there's a lot of information concern about this that needs to be clarified. In our nightly Zoom sessions, we can answer any questions you want about allergies.
Great.
Thank you, Candace.
Okay, thank you. We're going to go to another live question. We're going to ask Leila Meskin to come on the line to ask a question. Leila is there. Go ahead, Leila.
Thank you, Candace, and thank you very much, everybody. I'm Leila Meskin. I'm from QP 4207, Brock University. And my question tonight is, what can we say about this growing movement of misinformation to encourage people not to take vaccine, and what can we do about it?
That's a good question. Tara, did you want to take that? And maybe after I'll go to Fred as well.
I think every single one of us needs to be involved in helping get good information out to people. Make sure that you're using good, trusted sources for your information, and try to talk to family and friends who may be concerned. Send them the links to our Zoom calls. There are all kinds of places where you can find debunking of a lot of the common myths. And I believe that there may be information on the CUPE site as well related to this. And if not, we are happy to provide any resource that you can, but we all need to be trying to help others get good information, but not be judgmental about it, right? Recognize that the large majority of people who aren't sure just aren't sure. They need more information. They need to be able to make a good decision for themselves and others.
And we must be respectful of that and not dismissive or angry with people who choose or aren't sure about vaccination. People need to be supported and they deserve that support.
Great. I'm going to go to Fred, and then right after Fred, Yolanda. Go ahead, Fred.
That's great, Tara. And I'll just quickly add that, look, we're in this situation because, well, not just the situation about vaccination. The situation we are in the second wave, we're here because of a political failure by our provincial government. They had an obligation to be doing public health education when we knew vaccines were coming. We knew that for months this was coming. They've completely failed to do that, just like they've failed to adequately contact trace, just like they've failed to adequately bring in regulations in workplaces, just like they've failed in so many ways. And so when we're surrounded by that kind of thing, it can breed in us a cynicism. And it's understandable for us to have that cynicism, and I encourage it, frankly, when it comes to the Forward Conservatives. But this is not about being cynical about our the way in which we can be part of a solution here. The provincial government has been failing to do its role, but we can actually be part of a solution here, not just by advocating at work to have the proper PPE, pushing our supervisors, taking every possible precaution in our collective agreements, advocating and using our rights, not just to keep us safe, but to keep the public safe. That's part of what we can do. What we can do is, help to share this information about vaccination, share information about these webinars that Tara and others are doing. It's why we're doing this webinar tonight, and just keep repeating the message over and over that our union understands how to support our members. But one of the ways we support each other is to make sure we have the right information. That we are empowering people with the right knowledge, not the misinformation that is there, and encouraging us to do what we must do to be part of helping to solve this for ourselves and for our communities.
Yolanda?
Yeah, thanks. I just thought I would also add to that piece, like I was thinking like in 2013, the flu vaccination, the rate in an area like Scarborough, North Scarborough, like Malvern area, where it's predominantly racialized folks, like only 10% of folks took the vaccine at that time. And they took it because they didn't trust the system, or they also didn't trust who was actually giving out the vaccine at the time. And it is a bit like there's a historical discussion about this that is also included in the conversation about racism and fears of like getting sick once we take once you have the vaccine, and also like distrust. And our communities and our organizations, Black, racialized, and Indigenous folks, absolutely, because it's historical, have every right to have those feelings inside. But it is incumbent amongst ourselves to be more educated, to talk about it more. And then once those folks in 2013 also had that education and had folks that looked like them, prepared to educate them and give them the vaccine, then the rates of the vaccine increased immensely. And it's we do have organizations, we do have communities that are able to do this work, and we have to go to our government and tell them like we're afraid for different reasons. Lots of them are personal, lots of them are historical, and to find ways to do this better so that we can have the vaccination. Friends have told me they're not getting it because they just don't trust, but it's all about being educated and having the discussions and talking to folks around them to encourage them about getting the vaccine. And our communities that can do it, they've done it before in the past that have raised the rates of having it done, and I think we can do it again.
Great, thank you, Yolanda. Okay, so next question. With the emergence of COVID-19 variants being much discussed in the news, people have questions about the variants and the effectiveness of the current vaccines against them. So how effective are the vaccines we have in Canada against the new COVID-19 variants? Tara, did you want to take this one?
Sure.
So right now the evidence we have is that the mRNA vaccines, the Pfizer and the Moderna, are slightly less effective against the so-called UK variant. But the difference is small enough, and these vaccines are so effective, so much more effective than actually anyone hoped they would be, that it is not a huge change. There are more concerns about the South African variant, but still these vaccines are inducing an immune response that's strong enough that it's good enough. So they're so good to begin with that we have some wiggle room because of these variants, even though the vaccines aren't quite as good against them as they are in the older versions of the virus. But of course, the thing that everyone fears, that scientists fear, is that if we don't get case numbers under control around the world, that as we introduce vaccinations and as there are tons and tons and tons of people who are still infected, that you're going to select for, or you're going to, there are always mutations that arise naturally in all of us as well as viruses. And that over time, we're going to start seeing variants, new variants emerging that are against which the vaccines are less effective. And so we need to not only vaccinate people fast, but we need to get case numbers under control by every measure possible. And right now, the most effective measure until we have mass vaccination is the simple public health measures that we're all following right now. So we've got to do both. And we've also got to really push to bring those case numbers down as absolutely low as possible, or we're at great risk of something like that happening. We don't know if it will, but certainly it would be problematic if it did. That being said, Moderna, for example, has started. So they've started make mRNA vaccines are very quick to make, the original scientific part of them. So they've started making vaccines to recognize these variants, and they will be getting ready to put them into trial. So this technology is so fast that they may be able to go to trial with them. So they've already started that process just in case they're needed. And then all are just going to have to hope against hope and keep using good public health measures.
Great, thank you so much. We had a number of people email in about questions and concerns around pregnant women taking the vaccine or women planning to get pregnant. Is it safe for pregnant women or those planning to be pregnant to take the vaccine? Tara?
So, the Canadian, so there are multiple associations or colleges of obstetricians and gynecologists that have released statements on this issue. One is the Canadian Association, one is the Royal College of Obstetricians and Gynecologists in the UK, in the US as well. And all have stated that there is no evidence that these vaccines are harmful or pose a risk to pregnant women or breastfeeding women or women who are planning to become pregnant, and that based on previous experience with mRNA vaccines, it's highly unlikely that there would be. However, we still don't have full evidence yet about safety. So many women throughout the world who are healthcare workers and are at great risk have actually chosen to be vaccinated, and they are being monitored. So we're going to know more over time. So right now, this is, we can't say with certainty that they are safe because there's not the evidence to support that, but there's also no evidence that they are of any danger, and it's unlikely that they would be. But this is very much a choice for individual women to make in consultation with their doctor. The other thing I want to highlight on the other side of that, and the reason these societies have all come out with these statements, is that pregnancy itself is a risk factor for more severe COVID. So pregnant women are 10% more likely to be hospitalized with COVID and are more likely to end up in the ICU. and there have been worse birth outcomes associated with COVID. So that is a very real and not a trivial risk compared to what doesn't look like a very big risk of the vaccination. So this is why many female healthcare workers have chosen and wanted to be vaccinated to protect themselves from COVID. This is a decision to make. The other thing about fertility, you commonly hear people say that the vaccines affect fertility. There is zero evidence to support this claim. This is misinformation. It is, I guess it's, I don't know if you call it an urban myth or whatever you call it. It's all over the place. It's completely untrue. And some of the statements that have been made saying that there's no mechanism to support it, the vaccine doesn't cross the placenta, doesn't affect, it's not going to affect viability of a fetus. And this has been sort of fabricated out of it's completely fabricated, but there's been a lot of work that these societies have had to put in to push back against that and say there's nothing true that's being said about it. However, we do know that COVID itself, actually, there have been some studies that have found that COVID does appear to affect male fertility. There has been no comparable evidence that's been found for female fertility. But that's a really common thing that's out there that's just not true. It's not supported by evidence. So it's not something to worry about.
Great. Okay, after this next question, I'm going to start taking people live. Just a reminder to try to be as concise with your comment as possible, and to the panelists, concise responses. We have 140 questions and only 30 minutes left to go. Many members wrote in with concerns about the length of time that they're now being asked to wait between the first Pfizer vaccine and the second shot. This is a result of the government's having to delay access to frontline workers because of the supply problem. We have been assured by government and by Dr. Yaffe, who participated in a call that Michael and I were on. They said that the delay time now between the shots is going to be going from 21 days to up to 42 days. That has been clinically tested and tried and is considered perfectly safe and still effective. The government does have research and science studies on that can be made available. That was one of the questions I wanted to just provide an answer in that regard. We're moving on now to Keisha Bokhari. I'm going to ask for Keisha to be brought on the line, and Keisha is there. Please go ahead, Keisha.
Hi. I had asked to remain anonymous, but I hadn't done it properly. But I wanted to ask Darren Jeet. You spoke about religious grounds for exemption and medical grounds. I know in schools, children can be exempted also based on conscientious grounds. Would that be the same in the workplace if someone were to decline the vaccine?
And so you'd have to root it back to one of the enumerated grounds under the Human Rights Code, be it either religion, creed, disability. So it'd have to root back to one of those enumerated grounds. So it'd be a very personalized issue, and whether or not the particular conscientious ground can be rooted in one of the enumerated grounds in the Human Rights Code. So definitely a conversation for you to have with your local and your national representative, outlining for them the reasons that you believe or the reasons that you cannot take the vaccine for on your conscientious grounds, and they'll be able to advise you on whether or not there is a human rights-based exemption or process they can go through for you. So be very personalized.
Great, thank you, and my apologies to you, Keisha.
Right.
We're going to go to the next question. It's from Heather Stewart. Heather is going to be brought on the line here. Just give the technician a second to get her up for us. Oh, it looks like she is not coming on. She might be disconnected. Okay, so we're going to go to another question. How about we go to Jennifer Bailey? Give the technician a second to get Jennifer Bailey on the line, please. Okay, and Jennifer Bailey is also not on the line. How about we go to Michelle Johnson? Is Michelle Johnson on the line? Yes, Michelle Johnson is on the line. Go ahead, Michelle.
I have one of the questions with regards to getting the second shot. I had received the first shot of the vaccine due to being a central caregiver for my grandmother in a nursing home. I'm due to get the second shot this Saturday, and I'm just concerned because of the shortage. If I wait too long, do I have to start over again to get another shot and then do the whole process over? So I'm just not sure where to go from there.
Tara, did you want to take this?
I could probably answer. So if they haven't canceled yet, just hang on.
Okay.
You might be fine. Most people many people who've been canceled have already been canceled. So what I would say at this point is that it's unlikely you would start over. Most experts would say that if you go out to about 42 days after the first shot, you probably are fine. They're going to be monitoring this as this goes ahead. None of us expect it. Well, we're in a real world experiment, so it's being monitored. And what would be most likely to happen if people didn't have the level of immunity that we would want after the second shot is you'd get a third booster later on. So you wouldn't go back to the beginning and start over, but you would probably be put into the line and given a third booster. Scientifically anyway, there's good reason to think that this would actually work fine. But of course we don't know yet. We don't know well enough, but otherwise just hang on. Hopefully you're not going to get the call this week and you're going to get the second shot.
Fingers are crossed. Thanks so very much.
Oh,
okay, thank you so much. We're now going to go to Todd Canning. Can we get Todd on the line, please? Todd is there. Go ahead, Todd. You're on mute, Todd.
Hello.
Go ahead.
Sorry, Candace.
That's okay.
Multitasking here. My question, I'm president of Education Support Workers Local with York Region District School Board. My question is regards to the notion of students whose parents may not want them to take the vaccine rather, and what implication that means for workers and working in the environment where PPE seems to be minimal according to the guidelines. Just a medical mask and shield. Now they're exploring in Toronto District School Board with the notion of N95s. So it's sort of a broad question, but I'm getting some queries from workers whose anxiety is quite high in working in the classrooms so close, because classrooms were never built, even in new schools, for social distancing. Thank you to everybody. This is fantastic. We need to do.
Thank you. Thanks, Todd. Do you want to answer that, Tara?
I think Paul might be a good person, but what I was going to say is that I don't know if this is going to help with anxiety or not, but it is extremely unlikely that children will even be in line for a vaccine until late summer. So it's sort of, this is going to be a non-issue until then. So perhaps we'll have a lot more information about a lot of things by then. So that might be a good time for people to, getting into the summer, for people to start worrying or thinking about this. But for right now, there's absolutely nothing that we can do about it because they're not going to get vaccinated until the end of the summer anyway, at best with the current schedule. So it might just be good to wait until closer to then and then think about it at that time. But I completely understand your worry. It's not a great setting.
Great. Thank you so much. I am now going to ask for Ryan Flamand to be brought on the line. Ryan is on. Go ahead, Ryan.
Hi, I'm from Local 65. A member of mine just wanted me to ask this evening. She wasn't able to attend. She's concerned because she gets tested regularly, not only for her employment as a healthcare worker, but also because she visits her father in long-term care.
together as a group. How do we actually achieve power in our workplaces? It's that collective action. And so it is important that others become vaccinated to protect you, just as like it's important for you to become vaccinated to protect others, just like it's important for me to wear a mask to protect myself, but also to protect others. Just like all of these measures, I think on some level now, you know, I'm a trade union leader, we're all union members, but one of the things I think about a lot is the way in which the collective nature of the work we do in a union is actually quite key to a global health pandemic, and the collective response we should take to support one another through these challenging times. And that's the importance of having all of your coworkers supported to feel like not only can they, you know, get through this together, but that we can do everything together that we can to protect ourselves and each other and the people we come in contact with at work and the people we come in contact with in our communities. That's why I said earlier, it's part of that collective responsibility we share as union members, but also as just, you know, folks who live in communities who care about each other.
That's great. Thanks so much. And for those of you who are asking about information regarding Dr. Moriarty's nightly Zoom calls, you can find that information on the CUPE Ontario website. It is there and readily available. Just for the technician, I'm going to go to Grace Hamill, and then after Grace, we will go to Ed Thomas. So Grace, please go ahead, you're on.
I'm hoping my headphones are working good. So I'm from Local 4948 and Library Service Workers, and we have some questions in regards to the right to refuse. Is the right to refuse still valid if you're instructed to work with others that have refused to take the vaccine due to their own personal beliefs?
Paul, do you want to take that one? Or
Yeah,
Sarah?
it would, your refusal to work with someone who hasn't received the vaccine is entirely dependent on the precautions that are in place already. If the precautions aren't going to protect you, and if this person is, you know, has a likely, you know, has not been screened, or there are people that you're engaging with the public where you have no idea if they've come into contact with someone with COVID-19 or if they are positive, or if you're providing, you know, for those, I know you're a library worker, but those who provide care to people with COVID-19, there's a risk that is involved, and that risk has to be assessed in each circumstance to determine what protections have to be in place to protect you. And just on the grounds that a person has not had a vaccine might not be enough for the Ministry of Labor to uphold a work refusal. But if you have a reason to believe that the protections that are in place right now are not protecting you, you certainly have the right to engage the work refusal process. But a lot of that, whether or not the ministry will uphold that decision, is based on determining if the protections that are currently available are enough. So it is, if you have any concerns and you feel as if you're not in danger at the present moment, it's good to have a conversation with someone who's really familiar with the workplace protections, like a member of the Joint Health and Safety Committee. Because they are engaging with the employer to always try and find the best possible precautions that are available. And if some of those precautions aren't there, and there's a likelihood that you could get COVID-19, they'll be there to counsel you and to help you understand if those precautions are enough.
Great, thank you. Okay, next I'm going to go to Ed Thomas, and then after Ed, we're going to go to Donna Lamb. So Ed, you're on, please go ahead. And you are on mute, Ed. Okay, maybe we'll let Ed get his technical difficulties figured out, and we will bring on Donna Lamb. Donna, you just need to unmute yourself and then you're good to go. Go ahead, Donna.
Oh, I'm just trying to remember what my question was. If a person chooses not to get the vaccine, will they always be at risk for the COVID? Will this virus ever be gone?
Probably not. Probably not. This virus is around unless we can eradicate it in every part of the world. It will likely be around with us for a long time. And vaccination is probably one of the only ways that we will be able to prevent people from getting it constantly. It's just like measles. Measles is not eradicated around the world. And if we're not careful and our vaccination levels go below a certain percentage of the population, measles comes roaring back. And so that is likely what will happen with COVID-19 or, COVID-20 or whatever, whatever
any of the
follows
strains,
but that's related. Yeah,
okay,
exactly. Thanks. Yeah, no problem.
Thank you.
Okay, that's great. Before we go to our next question, there are multiple questions coming in about people with allergies, multiple kinds of allergies, and is it safe for people with multiple kinds of allergies to take the vaccine? Several questions on a range of allergies. Yeah. Please go ahead, Tara.
Yeah. Yes. So the only allergy that is a concern for these vaccines is polyethylene glycol, or PEG. And it is so rare that there are only 5 new people each year diagnosed in the US. And we don't even see a new case of it every year in Canada because we're a smaller country. It's extremely rare. Anyone who has this allergy would know long before adulthood. So if you can take, it's in most over-the-counter medications, it's in Tylenol, it's in cold medications, it's in, if you take over-the-counter medications, you're probably fine for PEG. But there are no allergies, no drug allergies, no environmental, food or insect or any other kind of allergies that are a problem for the 2 mRNA vaccines. We don't know for the others yet, but these mRNA vaccines are fantastic that way. So I hope that really puts a lot of people's worries to rest.
Great, thank you so much. We're gonna go next to G. Forkiotis. I'm sorry if I have not pronounced that properly, but G. Forkiotis, go ahead.
Hi, my question is, can the employer make people with current accommodations return to in-person work once you've been vaccinated?
Is that a question for Saranjeet, perhaps?
I think it would largely depend on why you were accommodated with the work from home. If it had to do with a medical condition, was it a physical restriction, and whether or not those accommodations are still needed in order to protect your rights, be it, is it disability, is it, religious, is it physical, does it have to do with COVID-19 or perhaps some other responsibilities that you have, a family status accommodation, for example. So what you'd want to look at is why was the original accommodation needed and whether or not those factors continue to exist. And if they continue to exist, there's a case being made that the accommodation should continue. And then there will be, of course, the conversation around undue hardship. And undue hardship, it's a legal principle, it's relatively opaque, but it's pretty much an arbitrary line that eventually an arbitrator will draw saying, the employer has done enough and the next step is unreasonable. And we're always trying to push to make sure that as much accommodation is provided so that individuals have their rights protected under the code. So at a high level, you want to understand what were the factors that led to that accommodation being needed and whether or not those factors continue to exist. And then you'll be able to have an answer on your personal circumstance.
Great, thank you so much. We're gonna now go to Mary Rita. Mary, give Mary a second to come on. Mary, you are on the line, please go ahead.
Hi, I'm Mirita, and I'm local 4092, which is QP flight attendants. And I just wondered, is anyone on the panel hopeful for a Canadian developed vaccine, especially with all the delays and that is happening right now?
It's a good question. Tara,
So
please go ahead.
I can respond to that. So we do have a couple of Canadian vaccines that are have made it through preclinical. So this is the stage before it even goes into humans, and one that is in the very first stage. They are probably at least a year out if they work. So lots of vaccines will fail after that initial first or second there. The problem is that, like everyone else, when all this started last spring, everyone was going as fast as they could. But as we know in research, 90% of experiments fail. And everyone was just going in parallel on their best ideas they had. And we were just hoping that something was going to work. So we don't have a guarantee that these will work. Although it is possible, there may be some measures taken to be able to produce some of the vaccines in Canada. In some of the old, there's an old research facility in Montreal that's being refurbished with the possibility of it being used to make vaccines for an existing vaccine owned by or patented by another company that might allow production elsewhere. So we don't know, but we're pretty far out with the Canadian versions.
Thank
you. Great. Thank you so much. We're going to go to Marie-Michelle Valancourt. Marie-Michelle, go ahead.
Okay, hi. I was wondering what's the difference between the RNA messenger vaccine from Pfizer and Moderna and the more traditional ones?
Very quickly, mRNA vaccines are, first of all, they've been around for a long time. They've been used and developed for cancer treatment, and versions of them were used to try to develop vaccines for SARS, as well as MERS, which was another coronavirus that came along. They're different than previous vaccines in that previous vaccines, they tended to be based on making a tiny part of the virus outside, and then like a protein, for example, or some little piece of it, and then injecting it into people. And just like we would if we got a splinter and we introduced something into our bodies that caused an immune response, the same idea. And our bodies would react to that and we would develop an immune response. With some of these methods, there are some materials and some things that are in these tiny pieces of the viral product that can themselves cause some allergic reactions in others, which is part of why some of these vaccines cause allergic reactions. The mRNA vaccines, mRNA is like a photocopy or a Post-it, or it's kind of like a wanted poster image of the sort of the face or the code of the virus. It's highly unstable. So one of the tricks for making these vaccines was to get it into these little fatty droplets that we could put into our body, inject where it wouldn't break down right away. Once it gets into our cells, then our cells start making a little bit of that viral product, not the whole virus, just a tiny little piece of it, and then that drives the immune responses. So they're much cleaner. They have far fewer ingredients in them that could cause cross reactions. But in addition, one of the great benefits of them is that technically they're extremely fast to develop and test new ones at the very early, basic wet lab kind of scientific stage. The trials and everything take exactly the same amount of time as other vaccines, but that early stage, we can do it much faster than historically we used to for other vaccines. But otherwise, some of the immune responses are quite similar. The other really good thing about the mRNA vaccines is that they've been highly effective in older adults, and many vaccines aren't, which is why sometimes older people have to have high dose flu vaccine, for example. And so these vaccines have turned out to be really good at causing immunity in older adults. So this is also why we're lucky that they came along now in terms of protecting older adults. Most of us are probably going to see the other vaccines unless we're essential caregivers or working with or in those high priority groups. And those vaccines are probably going to be good enough for most of us. There is some possibility that if someone may have an allergy to some of the more traditional vaccines, that they may have access to the mRNA ones. But we just don't know yet. That hasn't been sorted out because there is no other vaccine that's been approved yet in Canada. So once there is, or if there is, then we'll have to have those conversations then.
Great. Okay. Thank you very much. We promised you that we would keep it to 90 minutes tonight. We are at the time limit. So I want to thank all of our panelists, but I'm going to turn it over to CUPE Ontario President Fred Hahn to say some closing remarks. Fred?
Thanks, Candace. I just want to say thanks to all the panelists. I want to say thanks to all of you for tuning in. I know this is, we answered as many questions as we could tonight, but there are many more. I want to encourage you and remind you that if you go to the CUPE Ontario website, cupe.on.ca, you will find information about how to access Dr. Tara Moriarty and the work that she is doing with others so that people can ask more questions. You can share that through your workplaces. I want to say thank you to our interpreters, both our ASL interpreters and our French language interpreter tonight. And I really want to thank all of you. These are challenging days, but I know all of us on this call recognize that our members are part of working frontline in our communities to keep our communities going and to keep our communities safe. You are all doing incredible and vital work. I am so proud to be in the same union with all of you. These are difficult and challenging days, but I know that we can get through this together. Always know that you can rely on your local union, on your national staff rep, on specialists in CUPE, that we will try to provide and connect resources like the ones to Dr. Tara Moriarty and others in the community. And just a heartfelt thank you to you all for joining tonight, for the work that you're doing. And please take care, stay safe, and have a good night.